Hello, everybody. I'm Peter Phillips, and I'm with New Brunswick Broken Healthcare Group. Um, Today, we're going to review what we're posting in our We Investigate tab. We'll just go in there now. Um, we're going to review a report that the Montreal Economic Institute, they're called MEI, that investigated tens of thousands of people leaving New Brunswick's ER rooms. Um, this is for New Brunswick, but they've also done reports for, Quebec and different provinces. So New Brunswick isn't alone in this issue. We're near the bottom as far as, or I guess near the top, because we have a lot of people um, that leave the ER without being treated. I've had to do that myself, and there was actually, if you go on the home screen here and you go down, um, there was a CTV interview I did, and I basically said I might as well die at home as opposed to sitting in those hard chairs in the waiting room, because you know that it's going to be hours before you're ever seen. So, um, back to the We Investigates. The MEI found that 41,000 patients walked out of Horizon Healthcare network in 24-25, so that's recent. That's 12.9% of ER visits. So that's pretty high. Now they'll tell you that most of those would be just, looking for prescriptions, cuts or whatever, which is probably the case. But there's also people that are at the top category um, that are walking out as well. So Vital, 22,000 walkouts in 2024. That's 11.5% of all ER visits. Um, Now that's up 19% or 19,000 from the year before. I don't know how anybody could rationally explain that. I mean, there are more people in New Brunswick, but not that would cause that large of an increase in walkouts. Uh, Vital was reluctant to provide the numbers; they had to be pushed. So obviously, Horizon or Vital don't want these numbers out because they're just really shocking. Um, Walkout rates across Canada up 36% since 2019. So 1.2 million walkouts, 1.2 million people aren't being seen that actually make the effort to get in the car or go on transit to go and sit in an emergency room. And a lot of times, I know, like myself, I think I was like 6 hours in before I gave up and I walked out. So that's just that's crazy. Um, the obvious reasons why people are leaving, long waits and overcrowding. We have the seniors in the hospital beds, and that is yet to be addressed, and that's a very severe issue. People don't have family doctors. We should be building clinics where doctors can group together and look after patients. Young doctors coming up in the system, they don't want to be that only doctor in the office. That they they demand more of a life work balance. So they're happier in clinics where there might be 4 or 5 doctors, and you know, if you need a week off, you can take a week off, and patients are covered. So the MEI says these patients aren't not leaving because they feel better, but because the system is failing them. Well, that's kind of an understatement, overstatement. I don't know. Horizon, every patient who leaves without care is someone who needed care. That's unacceptable. That's been unacceptable for the last 20 years. I mean, and they use these exact terms. So, and Vitel CEO admits data gaps, but says monitoring is ongoing, which is just a bunch of, you know what. The MEI recommends more upstream care options to take pressure off ERs, including nursing practitioner-led clinics. I mean, that's been out there for quite a while. Expand the pharmacist roles. That's being done, but they can only go so far with that. Uh, Independent urgent care centers um, follows the French model. So the bottom line is that people walking out of ERs at record levels, obviously not because they're suddenly healed after a 6 hour wait. They can't take it anymore. It's not just the sitting in the hard chairs. It's the way they treat you. You 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 really feel like a second class citizen. Like they just don't recognize you as human beings. Um, in a system that should be based on customer care, um, our healthcare system is so far from that. They don't have that empathy. Some do, but most don't have that empathy for the patients. And they sit in their little office in ER there with the nurses, and they're chatting away. I mean, I've been there and I've heard them. I've listened to them. They're chatting away, and you expect, because you've watched shows like ER on TV where things are just boom, boom, bang, bang. Everybody's running around in ER. People are being dealt with. That's not how our system works, especially in New Brunswick. It's a very slow paced, very um, no urgency, and they will give you all kinds of reasons why that's the case. But I think they can pick up their pace a little bit and start processing some of these people instead of just um, sitting there. That's just my opinion. So that's it for today's We Investigate. We'll see you on the next one. Thanks for watching.